Good morning, Ben. Thanks for joining me. I wanted to pick your brain about this fascinating article that just came out. Effective treatment modalities for amblyopia in subjects older than 7 years. Alex, always a pleasure. I actually just finished reading it myself. It's quite a paradigm shift, isn't it? For so long, we were taught that amblyopia treatment was largely futile after that critical period, typically around age 7 or 8. Exactly. And that's precisely where this paper challenges our long-held beliefs. The introduction really drives home how many older children, adolescents, and even adults were essentially told their condition was beyond remediation. But the evidence presented here, particularly regarding neuroplasticity, suggests that's simply not the case. Indeed, the idea that significant plasticity persists beyond the traditional critical period is incredibly encouraging. It moves away from viewing development and plasticity as categorical states and more as a continuous function, albeit one that peaks in early childhood. This has huge implications for my adult patients who might have given up hope. Absolutely. And from a pediatric perspective, it means we can continue to be aggressive with treatment for our 7 to 12-year-olds and even consider options for teenagers. The PEDIC studies mentioned, for instance, showed that children aged 7 to 12 years still respond remarkably well to patching and atropine penalization, with success rates comparable to younger children. That's vital information. I was particularly interested in the discussion around optical correction as monotherapy. The article states that even in older populations, including children up to 17, optical correction alone can result in meaningful improvement in a significant percentage of cases. It really underscores the importance of ensuring optimal refractive correction as a first-line therapy, even before more intensive interventions. I agree. It's a reminder that sometimes the simplest intervention can yield significant results. But what about the newer modalities? I found the sections on perceptual learning approaches and virtual reality-based dioptic training particularly exciting, especially for your patient demographic. Absolutely. Perceptual learning, for instance, seems to be a game changer. The systematic review highlighted that treatment success appeared independent of subject age, with patients ranging from 7 to 60 years. It's a distinct philosophy, focusing on systematic visual practice rather than just occlusion, and it seems effective even in cases where conventional patching has failed. And the internet-based delivery of perceptual learning really expands accessibility, which is a huge plus for compliance, especially with older, more independent patients. Precisely. Then there's the virtual reality-based dioptic training. This is truly cutting edge. The pilot studies and randomized controlled trials show promising results, particularly for adults and those with severe amblyopia. The engagement factor with interactive video games and the direct targeting of binocular vision are significant advantages over traditional methods. Imagine a 30-year-old improving their vision while playing a VR game. It's a fantastic development. The article also touches on combination approaches, like transcranial direct current stimulation with dioptic video games, suggesting that engaging both behavioral and neurophysiological mechanisms could offer enhanced efficacy. It really opens up avenues for personalized treatment plans. Yes, and the factors predicting success are also crucial. While age remains a factor, it's a gradual decline, not a hard cutoff. Anisometropic amblyopia generally responds more favorably, and baseline visual acuity and prior treatment history also play a role. But above all, compliance is highlighted as a critical determinant, which makes these engaging, less socially stigmatizing treatments even more valuable. So, the take-home message is clear. Amblyopia is treatable well beyond the traditional critical period. We need to revise our clinical practice to ensure older children, adolescents, and adults are offered appropriate evaluation and treatment, rather than being dismissed. Couldn't have said it better myself, Alex. This article provides a strong evidence base for a more optimistic and proactive approach to amblyopia management across all age groups. It's an exciting time to be in ophthalmology. Absolutely. Ben, thanks for this discussion. It's always great to share insights. My pleasure. Let's keep an eye on these emerging modalities. Chuckles.